Need more sleep. Why lack of sleep is so dangerous for the heart. Lack of sleep is much more dangerous for the heart than one might think, as scientists from the University of Colorado at Boulder, USA, found out. They thus identified a mechanism that explains how lack of sleep provokes an increase in the risk of death from stroke and heart attack. The researchers analyzed blood samples from 24 people aged 44 to 62. Approximately half of the volunteers slept 8 hours a night, and the other 5 hours. The scientists measured the expression of 9 different microRNAs, short-stranded RNA molecules that regulate the activity of specific genes associated with inflammation, immunity, and vascular health. It turned out that people who sleep less than 7 hours a night have low levels of 3 regulatory molecules related to miRNAs. These compounds play a key role in reducing inflammation and maintaining normal blood vessel function. As you know, sleep deprivation interferes with the normal functioning of the cells that line the inner surface of the arteries, which as a result do not narrow and expand normally. This leads to a range of cardiovascular diseases and increases the risk of dying from them. Sleep and heart disease. Although all aspects of the relationship are not clear, there is definitely a direct link between sleep, sleep disorders, and heart disease. Medical specialists have already found an increased risk of sudden cardiac death in the first few hours after waking up, probably due to the need for increased heart work that comes with waking up. Various studies have also shown a clear link between sleep disturbances and the frequency of high blood pressure, increased risk of heart disease and stroke. In fact, treating certain forms of breathing disorders while you sleep can actually reduce your chance of developing certain cardiovascular conditions. Congestive heart failure. Congestive heart failure occurs when the heart becomes so damaged that it becomes unable to pump blood efficiently. Sleep and breathing disorders can be both a cause and a consequence of heart failure. Studies have shown that OSA is a significant risk factor for the development of congestive heart failure. In addition, in individuals with heart failure due to other causes, such as coronary disease or hypertension, the risk of worsening congestive heart failure increases with the development of OSA. The heart muscle, which is already in a weakened state, is unable to withstand the additional stresses caused by OSA. However, treatment of OSA may improve cardiac performance in patients with congestive heart failure. About 40% of people with congestive heart failure also have a sleep-related breathing disorder called central sleep apnea. During sleep, with central apnea, repeated respiratory arrests resembling OSA occur. However, in central sleep apnea, the patient stops making breathing efforts when the airway remains open. Central sleep apnea also causes frequent awakenings and drops in blood oxygen levels. Waking up speeds up your heart rate and raises your blood pressure, which can make heart failure worse, lead to more central sleep apnea, and cause a vicious cycle that worsens heart function. The main approach to the treatment of central sleep apnea is to prevent their occurrence by treating heart failure as carefully as possible. If central sleep apnea persists, therapy is available to correct it. Treating central sleep apnea can improve heart function as well as sleep quality. Stroke. During a stroke, damage to the brain occurs by reducing or cutting off its supply of blood and oxygen. Hypertension is the most common cause of stroke. As shown above, OSA leads to the development of hypertension. In addition, OSA can directly cause strokes because during episodes of sleep apnea, blood flow to the brain is reduced and oxygen levels in the blood drop. Abnormal breathing patterns during sleep, especially OSA, are also common shortly after the onset of a stroke. Therefore, other manifestations of OSA, such as excessive sleepiness due to sleep disturbance and impaired mental abilities, may interfere with the recovery of a stroke patient. The impact of heart disease on sleep. As described above, sleep-related breathing disorders can directly cause heart disease. However, heart disease also has an effect on sleep. Although these effects are less strong, they should also be taken into account. For example, patients with congestive heart failure often report difficulty falling or staying asleep due to the shortness of breath that usually accompanies heart failure. Dyspnea often worsens when the patient lies down, because the increased blood flow to the heart from the lower extremities in this position can exceed the ability of the heart to pump blood. Doctors call these symptoms orthopnea, shortened breathing when lying down, and paroxysmal nocturnal dyspnea, waking up with a feeling of shortness of breath or suffocation. Patients experiencing these symptoms may perceive them as insomnia because their sleep is interrupted. In addition to these feelings, patients with heart disease usually worry about the long-term effects of an acute heart attack or chronic heart disease. Such anxiety itself can lead to the development of chronic insomnia. Considering all these additions to the direct interaction of numerous heart diseases and sleep disorders, it becomes clear that people with comorbidities seek understanding from doctors and need special help to ensure normal sleep.